Okay. Right. Here is all the information that you need about me in the QR code, which you can safely scan and collect all that information in as long as you maintain full awareness of the fact that I started my career in security researching malware and computer viruses, and I know every possible way that there is to get someone to install malware on their machine. But enough about me. This is Security Awareness Lessons from Dr. Bonnie. Subtitle, Why I'm Losing All the Respect That I've Built Up Over 4 Decades for Von Palmer and Why I Never Had Any Respect for Richard Zussman. That may become clearer as we get into it. You will not know who Von Palmer and Richard Zussman are. They are reporters, journalists, media personalities in the Vancouver area. I am not only not an American and therefore an untrustworthy foreigner, but I am on the wet coast of North America. So I'm in Vancouver, British Columbia, Canada. And that will become somewhat important. So some of these references will be a bit odd from your perspective. I'd just like to say that it's kind of interesting that BSidesGVL, while I certainly respect all the work that they've done in putting together BSides during these difficult times, it is kind of interesting that this, out of the various proposals that I made, was the one that they picked. Anyways, who is Dr. Bonnie and why should you care, and what does this have to do with security awareness? The Dr. Bonnie Show, as some of us call it, is the COVID updates from Bonnie Henry, Dr. Bonnie Henry, who is our Chief Medical Health Officer here in BC. This is not just interesting in terms of COVID, but it's been amazing as a masterclass, a real masterclass in effective communication of difficult topics and situations. And this is, there are so many lessons, so many pointers, so much you can take away from the Dr. Bonnie Show in terms of how to get across what may be a very complex topic. And of course, this is exactly the situation that we face with regard to security awareness if we're going to try and do it. The YouTube channel, and I have also pumped all of these URLs into the chat area, so you can go and pick up that there. You don't have to screenshot the slides, although you're perfectly free to do that if you wish. The Dr. Bonnie Show is there on YouTube, but this is in fact the BC Government Communications channel, and so you have to pick out the COVID update sessions from it, but it's all there now. I must say, of course, this being the BC government, they may not have made this stuff available worldwide, and you may have to go to a VPN and set your location to Canada to get it. But it's well worth looking at that. That is the background material, what we're doing here. Here is Dr. Bonnie Henry. This is in fact not just a nice picture of her. This is the cover of her second book, entitled Be Calm, Be Kind, Be Calm, Be Safe. And it is an interesting book in that while it outlines what actions were taken at the beginning of the pandemic and the decisions that were made, it also outlines some of those decisions which related to exactly how they were going to put together the COVID updates. And again, the decisions outlined there and the rationale for those decisions has a lot to do with security awareness and the principles and of effective communication that are important to security awareness. So that is again something that I would recommend, and that of course is easily accessible to any of you who are interested in that. You can go and get that. That, as I say, it's her second book. Her first book is also well worth reading, and that is entitled Soap and Water and Common Sense. Anyways, we're talking about communication. This was an interesting definition, which I recently got from somebody who obviously was into evolutionary biology. The process by which a transmitter, that's me, sends a signal designed to manipulate a receiver, that's you, a receiver's actions in order to improve the transmitters, that's me, inclusive fitness. And so here I am giving you a presentation at BSides, and of course the real purpose of this is to enhance my inclusive fitness. I'm not quite sure how that works out, but it's kind of an interesting way to look at things. Now, in regard to the pandemic, of course, one of the major problems that we have come to see is mis and disinformation. This has been a huge problem in the pandemic, but it's also a problem, of course, in security awareness and in the issues that we have to face. If we're going to pursue security awareness, we have to make sure that the information that we provide is right. And it's interesting to look at the reasons why mis and disinformation are spread, are created and spread. There is, of course, just plain ignorance. And that is one of the aspects. But another reason is fear. And this goes back to, as I say, I started out in computer viral programs research, the malware research. And one of the interesting things that I saw as I started out in that research was that people weren't doing anything about viruses. As a matter of fact, and I was just talking about this yesterday on another presentation, I was in the early days, conferences were few and far between, not like they are nowadays, but and one was being put together, and I contacted the people putting the program together and offered a presentation on my research into viral programs, and they turned me down. They didn't think that computer viruses were in fact a security problem. And that was one of the things that I saw, that because people didn't understand what viruses were in those early days, and there's an awful lot of people who still don't understand, that they decided what to do about them was nothing, because they didn't want to do the wrong thing. And again, that's a similar situation we see with the pandemic. A lot of people don't take appropriate precautions because they fear taking any actions in case it might be the wrong action. And so it's a very interesting one. And one of the lessons that we have to learn, and one of the lessons from the Dr. Bonnie show, is reduce the fear. There's also legitimate contention of ideas. One of the interesting things recently, of course, is ivermectin. And there are some interesting theories and hypotheses about why ivermectin might be a treatment for COVID. The unfortunate situation is that the studies that have been done have all been done in a fragmentary and partial basis, and there really is still no evidence, really one way or another, whether ivermectin does in fact treat people. Although the one piece of information we do know is certainly, a lot of people are taking ivermectin, and a lot more are getting sick and going into hospital from ivermectin poisoning than are getting better from not having COVID. Another aspect is fraud, and there are people who are out there just pushing supposed remedies, trying to obtain money from people by selling these things. And then there are outright attacks that are there's always in the midst of any disaster just people who want to see the world burn, and so different aspects of that. Now, again, as we talk about security awareness, one of the things that we have to watch out for is security theater, and the people, security theater is in general is something that you are seen to be doing something, even if what you're doing isn't in fact useful at all. So the powers that be, we have seen, we don't see this much anymore, but certainly at the beginning of the pandemic, you saw all kinds of these things where people were out spraying and fogging in open areas, trying to get rid of the virus. And as any infectious disease specialist will tell you, there's nothing you could spray or fog around open areas that would kill the virus that wouldn't kill you, or at least seriously harm you. So there are issues about we have to make sure that we have accurate information and we're not pretending that what we're giving people is going to help. At the same time now, as increasingly as the pandemic has gone on, the media, and this is where Zussman and Palmer come in, the media has decided to jump on this and, oh good, the authorities aren't perfect in the middle of all of this ghastly mess. Let's point that out and harp on it. And of course, that means that they are selling more papers. It's kind of like the media is doing what Facebook is doing, which is, we could give accurate and well-researched information, but it's much more profitable to get everybody riled up and upset, and buying the papers or watching the television news, whatever it may be, because we're creating a sensation, even though we're not helping the situation. So at last, to security awareness. Now, security awareness has a bit of a bad reputation. So many people, and I've encountered this over and over again. I started out basically as, I was a teacher. I still am a teacher. Here I'm teaching you. I was a teacher in elementary school before I ever got into computer security. Well, not quite, but so from my perspective, teaching, training, awareness training is important, but so many people in our industry say, no, it's not important, it doesn't work. Well, of course, security awareness is not perfect, but it does, it's a lot better than people give it credit for, because most of the people who say that security awareness doesn't work simply assume it doesn't work and don't try it. And when you try it, and this is one of the lessons from the Dr. Boney show, it really has a serious and significant impact. So security awareness, let's, when we're trying to do it, do you need charisma? I mean, look at me here. Do I have any charisma? Absolutely not. No. And when you watch the Dr. Boney show, no, Dr. Boney and Adrian Dixon are not exactly charismatic people. Do you need bells and whistles? Here we are, there's no bells and whistles. I got the slides. You will notice there's a little bit of graphics here, but mostly it's just text. So I don't have any bells and whistles. Humor, well, I hope that I do, but certainly the Dr. Boney show doesn't intentionally do any, and you don't actually need that. You can do security awareness very, very effectively without trying to be Saturday Night Live. So first thing, don't panic. And that's the first thing to tell people when you are doing security awareness, when you are doing your security awareness training. As I said, reduce the fear. Make sure that you are telling people the threats, But at the same time, you are saying, you know, that the situation can be managed, how the situation can be managed, what are the tools, and make sure that those tools are available to everybody. You know, don't go and say, don't worry, COVID, for example, can be handled by the monoclonal antibody stuff, because that's not available to anyone. It's hugely expensive. Much easier, of course, to go and just get a vaccine shot. So what do we do then? What are some of the lessons that we do in security awareness? Well, repetition is one of the first. Just simply get simple points and repeat and repeat and repeat those points. I can remember we have a traffic radio station here in the Vancouver area, and of course they've got tons and tons and tons of ads. And as we were driving somewhere one day, one of these ads came on. It was for Maple Ridge Motors, and it just kept on repeating the name of the company. And my wife turned to me and said, "That's a ridiculous ad." And I said, "No, actually, it's, you know, studies have shown that it's a very effective ad. All you have to do is repeat a simple point. You are going to remember the name of that company for years." And I was right, because I still remember the name of that company, even though we've never dealt with them. So simple repetition, you know, make sure that you have simple points, repeat them, repeat them, repeat them. That is one of the essences of security awareness training, how to do it. Now, consistency. This has been really interesting, and one of the big lessons, again, from the pandemic that it gives us in terms of security awareness. The information has been constantly changing. I mean, after all, coronaviruses are a class of viruses that we didn't even know existed until the 60s. And certainly, COVID itself, well, we saw SARS back in 2009, I believe it was. Maybe it was a little earlier than that. But we didn't have a big outbreak then, and so the research really didn't go on. Now, this is a pandemic. Everybody is researching it, and the information is changing all the time because we are finding out new things about the virus, and of course the different mutations, the mutations themselves. Now we're looking at the Delta variant. This is like 2.5 times more infective, more lethal than the original virus that we were dealing with when the pandemic first started. So that is changing. That is changing all the time. We didn't have vaccines at the beginning. Now we have vaccines. Some of the stuff is not changing. Hand washing is still effective. Masking at the beginning of the pandemic was not a big issue. Now we know that the aerosol, well, is it aerosol? Well, droplet transmission anyways, is much more of a factor than was thought, a year and a half ago. So that information, that kind of information is changing, and the importance of different aspects of the different tools is changing. The information is changing. What the Dr. Bonnie has done in the updates is to provide some sense of consistency by maintaining the format. The format hasn't changed. It's Bonnie Henry and Adrian Dix, who's our Minister of Health. That's why he's on there. And those are the people who are involved in it. And they give a presentation. Very often the presentation follows a very fixed format with data, the latest metrics on the pandemic. Some discussion of different aspects. There are various things that get reported on a regular basis. And then questions from journalists. And they've maintained that format for, almost 2 years now. And that, again, it's comforting. It reduces anxiety from people. And so it provides for some consistency in the midst of a situation that's very difficult. And of course, in security awareness and technology, in computer security, we are having to deal with that all the time. The situation is changing. Different types of malware are being produced. Different types of attacks are coming out. The base technology is changing all the time. Everybody argues about which field of technology is changing the fastest. And I always say that security has got a lock on that, because it doesn't matter what other field of technology is changing, that change has an impact for us in security. So, we're facing changing information all the time. So, find some way to maintain consistency with regard to what you're doing in security awareness. You've got to have patience. This is particularly interesting and illustrated by the question period at the end of the Dr. Bonnie show, when the reporters are asking questions and the same person asks the same question for the 142nd time in a row, or when the next reporter asks the same question that you've just answered for its 7 previous colleagues. And Dr. Bonnie never loses her patience. She never freaks out over this same thing that happens again and again and again. Very, very important lesson to take. Learn to answer stupid questions. This was an interesting one where one reporter really did ask a phenomenally stupid question, taking a huge long time to do it. And when he finally finishes, Dr. Bonnie just says, no, and then stops talking. That was really interesting. Social engineering is, we think of it in terms of a bad thing. I certainly, in malware research, we know that, security, that social engineering is used all the time to get people to install malware on their machines. But social engineering is something that we use all the time in education. And so use that to your advantage. Make sure that you understand your audience. Use social engineering to tune your materials. It's interesting. Adrian Dix came up with this simple slogan: "Bend the curve, not the rules." You remember bending the curve back at the beginning of the pandemic? People were talking about bending the curve, and so bend the curve, not the rules. And of course, you set up mandates, you set up rules, you set up lockdown restrictions, that sort of thing, and people always try to find some way around it. So here was a reminder. We got to keep the curve low. Don't bend the rules. So simple slogans are an example of social engineering. Again, keep the point simple, repeat it, repeat it, repeat it. Moving into other aspects of security awareness and different topics that we might be addressing, risk management. This is one of the things from risk management, which I have found is has not made its way into the public consciousness in the pandemic. And that is the fact that none of the tools that we have are perfect. And so the aspect of layered security, defense in depth, that topic really hasn't come through. And you don't get to choose. It's not one of, it's all of. And staying at home, distance, hand washing, masks, no parties, none of those individually are perfect, but all of them together provide you with a lot of protection. And it's the same with information security. You don't get to get one free click on a drive-by download if you choose a good password. Just, it does not work. So again, those kinds of lessons are some of the ones that we have to lean on in security awareness. Stick to the basic principles, but use illustrations from other areas, if necessary, to make those principles clear to people. Again, from risk management, to those vaccines, it's fairly simple math to prove the greater good to delay the second dose. This is, again, something that Bonnie Henry chose to do here in British Columbia. A lot of people were upset that she was trying to roll out a lot of first dose, get a lot of people vaccinated, not holding back the vaccines to provide for second doses, but getting people out there with their first doses and then rolling out the second doses. And that has come home to roost now, months and months later, because we're finding that here in BC, we have a longer length of protection times for those who are fully vaccinated than those who got their second dose right around the 3-week mark. Again, this is one of the interesting pieces of research that's come out of the vaccine situation. Cost benefit analysis. Now, this is really interesting. We in security, of course, security serves the business. So in the cost benefit analysis of staying in isolation versus reopening the economy, you would think that security serves the business. We would be on the side of reopening the economy, but life safety is always the number one priority. If, for example, you're going and writing the CISP exam. So no, there are higher priorities than reopening the economy at times. So again, some risk management decisions there. Again, one of the situations that we need to point out in security awareness training is that things are not going to be perfect. And this comes up in, for example, business continuity planning and situations like that, incident response planning. Nobody is perfect, and emergency management is for emergency. And this has been amply illustrated, not just by the pandemic, but the situation over the summer. I mean, we had the heat dome. My entire province caught fire. You guys have had, hurricanes and floods and situations like that. And so emergency management has been very much tested and found wanting in a number of situations. As I say, it's not perfect. And so again, when we are dealing with security awareness, we need to at least make people aware of that fact that, this is going to try and do the best that people can, but it's not going to address every aspect. After all, we are in the middle of a disaster. Something is going to be going wrong. By the way, in regard to emergency management, and again, I put this into the stuff I pumped into the chat channel. Search and Rescue North Shore from the Knowledge Network here in BC, and knowledge.ca is the site to go to. Again, I understand from other people that I've talked to that this is limited to people in Canada. So you will need to get a VPN and set your location to Canada in order to get access to this. But when you do, go and search for Search and Rescue North Shore. Wonderful, wonderful 5-part documentary series outlining the search and rescue team here on the North Shore. And it's also a gorgeous, gorgeous piece of filmmaking. They used multiple cameras, even connected to ropes and things like that, and edited together in a phenomenally good fashion. And of course, it's shot here in the North Shore, so it's absolutely gorgeous scenery that you're dealing with. But lots and lots of good lessons about security management there. One of the questions that the reporters keep on asking, how vicious are you going to get with people who break distancing rules, or whatever the rule du jour, vaccine mandates, masks, whatever it may be. And this question gets asked over and over again with different wordings and that sort of thing. And very interestingly, again, Bonnie Henry has refused to get involved with the divisiveness of this fight, and she has an amazing variety of ways to do that, to get out of this trap, and it is a trap, really. She certainly illustrates the principle that you catch more flies with honey than vinegar. Again, reduce the anxiety. Do not attack people. Do not say you are bad for choosing a bad password, but your life, your work will benefit from choosing a good password. Take that kind of position. Very, very important lesson. One of the important social engineering aspects of security awareness training to do that. Now, as I say, security awareness training has been unregarded in our industry. And the Dr. Bonnie Show, Bonnie Henry has consistently taken the position that you need to educate rather than mandate. She would much rather provide the information in the updates than issue another set of restrictions. And a lot of people, certainly a lot of people in the media have taken issue with that and said this is the wrong way to go. But BC is doing comparatively well. And so, very much thank you to Dr. Bonnie for proving that security awareness does actually work. Because when you look at the restrictions, BC has never had a lockdown that was as severe as many, many other places. Even right now, we're in a fourth wave, and we do have some local restrictions in local areas, and certainly with Thanksgiving this weekend, that's when we have Thanksgiving. It's when there's an actual harvest, not later in November when you guys have it. But and they've said, don't have big multi-family parties this year. This is not the year to do it, but they haven't mandated it. There's no Thanksgiving police going around and making sure that people aren't gathering in large numbers. But BC is still doing comparatively well relative to a lot of other places. And I can prove that because we'll talk about metrics. Now, one of the issues of metrics, a lot of people are on this transparency and accountability bandwagon, and they want the metrics. They want lots and lots and lots of metrics. Well, metrics should be useful. Metrics are not just numbers. Having lots of numbers and providing lots of numbers is not necessarily useful. This was an interesting cartoon that I found recently. The company notified you of a breach and shared the incident details and insights on the adversary, but they didn't share that data. But you have what you need. If we had forensic images, maybe we'd find more. Maybe, likely not, but all data isn't realistic, and sharing it with others poses other risks. Well, they aren't sharing then, and this is what the media is constantly harping on. Oh, by the way, if there's no other way that I can get you to take COVID seriously, I don't know why this issue has not gotten more airtime with the media. If the media really wants to do it, they would point out the fact that COVID-19 is linked to erectile dysfunction, and I'm sure that would improve, people's vaccine hesitancy and that sort of thing. But in terms of the format of what you're doing, I talked about the consistency here. Use an authority, not an authority figure. I don't know what it was down in South Carolina. Of course, everybody saw New York's presentations, and they weren't bad. But that was Como front and center, and he certainly had specialists backing him up and that sort of thing. But here in BC, we had Dr. Bonnie. We didn't have Premier Horgan. He wasn't on deck. Adrian Dix was there. He's the health minister, but not the premier, And so we had the authorities, not authority figures. And personally, I like speaking to B-Sides here because we don't get the technical presentations from the VP of marketing that we get in so many other conferences, and that's an issue there. But again, back to metrics. Lots of metrics in the pandemic: case counts, case rates, doubling rates, death rates, case per capita, hospitalization, IC, lots and lots of numbers. Positivity is one of the things. Oh, and by the way, in terms of metrics, there was a book by Broadby and Hinson, Pragmatic Security Metrics, and pragmatic is an acronym, and they have the different terms and factors that you should have in your metrics, and relevant, meaningful, accurate are part of them in there. But positivity rate is one of the ones that people have been relying on in terms of the pandemic. Here in BC, we've got a big film industry, and they were allowed to reopen fairly early, got going. They have very rigorous controls, but it's interesting. They do so much testing in the film industry that it actually skews our positivity rates for the province as a whole. It's kind of interesting. So you need to know what the metrics actually do mean. Again, the metrics and from the pandemic, in terms of the COVID updates, Bonnie Henry has consistently provided modeling, but refused to look at projected deaths. And again, she discusses that in her book. Was this going to be helpful? No, it was not. Modeling helps you planning for various things in the medical industry, but projected deaths, while it's great and sensational for the media, it's really not helpful for anybody other than undertakers. So, but in terms of the metrics, and now this slide, these next couple of slides are a little bit old now, but the numbers still hold. As of March, comparing per capita to the rest of Canada, BC should have had 3,000 dead. And comparing us to you guys in the US, BC should have had 6,000 dead. And instead, BC has saved over just over 1,000 dead at that time when I made this slide. So Dr. Bonnie has saved 5,000 lives at that point, and continues to save to this day on an ongoing basis. BC plateaued at 500 cases per day since November, and that has remained remarkably consistent. It's fluctuated up and down a little bit, but Dr. Bonnie said to vaccinate the deaths per day in November were 20 per day. The deaths per day at the end of March were 5, and that has remained remarkably consistent. So Dr. Bonnie is saving 15 lives every day. That the decisions that she made, the principles that I've been talking about in terms of security awareness that are illustrated by the Dr. Bonnie show, those are factors that illustrate the importance and prove the importance of security awareness. Educate, don't mandate. Education saves lives. A few other points. Change up your slogans and that sort of thing. Look at security awareness in the same way that you do advertising. Last year's commercials are boring. Come up with a new slogan, a new illustration, a new analogy, but of course, stick to the essentials, the basic points that we've talked about earlier. Functional versus assurance requirements. And this is something that we don't talk about often enough in security. Functional is our actual security tools. Assurance requirements are the ways that we can demonstrate that either the tools are working or that they're doing what we, in fact, want them to do. For example, you go to a restaurant, hand hygiene is important. You don't want anybody, making your food with hands that are unsanitary and therefore, getting you sick. By doing that, and of course you go in all the restrooms and they say, employees need to wash their hands, but Yes, that's a functional security requirement, but it doesn't give us any assurance requirement. You go to a Subway and you see they put on those gloves, cheap little gloves, plastic bag gloves. But you can actually see that they have the gloves on. So, the functional requirement of hand hygiene is there, but you also have the additional assurance requirement of actually seeing the gloves. And this comes out in a variety of ways. Mask mandates in schools, interesting thing. The functional, we're looking at isolation, we're looking at masks, physical distancing. They're all problems in schools. We're putting kids together. Hand washing is probably okay because kids can make a game out of anything, or you can make a game out of anything. And again, that's a good security awareness point. Make a game out of things. But in terms of the assurance requirements, detailed contact tracing is how we can get assurance. And we find that even though kids are getting more sick these days, there's still very low transmission in schools when you do the detailed contact tracing as to where they got the infection. Bars versus restaurants. Bars, here in BC, we had a really interesting restriction that bars had to stop serving alcohol, and restaurants had to stop serving alcohol before 10 p.m. Now, is alcohol more dangerous after 10 p.m. than it is before 10 p.m.? But in fact, looking at the numbers after that mandate came into place indicates that yes, it was very effective. So interesting to look at the functional versus assurance requirements. In terms of security awareness, don't speak down even complex topics. People will get it if you explain it properly. If you can't explain it simply, you don't understand it well enough. And that was said by smart person Albert Einstein. That also is quoted in Soap and Water and Common Sense by Dr. Bonnie Henry. And as I say, both of those books are very well worth reading.
So we're approaching the end of our time.
Okay. Hopefully, I've mentioned defense in depth before, so we don't need to do that. One thing, in regard to the Dr. Bonnie show, during the wildfires this summer, the BC Wildfire Service tried to have a similar messaging. They had metrics. They didn't have the consistent format, the same face, the messaging, and communications with the rest of the government. That unfortunately did not work. So again, here is Dr. Bonnie. I really think that she has done great things for us in the pandemic, but also given us a great illustration of what to do in security awareness training, and her mantra: be kind, be calm, be safe. That is something that will help us in providing security awareness for all of our colleagues.